Hi, I'm Dr. Hema Sathish. I'm a dermatologist by profession and the founder of Cureka.com. Well, last time I spoke about the introduction of atopic dermatitis, and today I'm going to talk about the moisturizers which you can use in case of atopic dermatitis. Well, when you come to moisturizers, you can think of home remedies like oils also, which would include coconut oil, sunflower oil, or evening primrose oil also. A few things to keep in mind is if these oils are actually infused with calendula, it will work like magic, yes. But you have to keep in mind that when you are applying the oil, you have to be sure that the skin is not infected or it's not very sore. In a sense, if you can see the lower layers of your skin, then you have to ask for advice before you apply this, because in that case you might need an antibiotic ointment and a steroid alongside to make the skin to calm down the skin rather, and to make it feel better. So you have to ask the doctor for a prescription, get the prescription and use these antibiotic creams and the steroids for the stipulated period of time prescribed by your doctor. And if you're using oils, suggestively use it before your bath, and then you can use mild cleansers when you're having your bath. Ideally, a moisturizer can be in a form of a lotion or in a form of a cream. So when do you choose to apply a lotion or a cream? Well, if you have just mild dryness and you're using steroids of a high potency, then suggestively you should use a lotion. And if you are using a steroid on a regular basis or for a long period of time, then you can use a cream also, probably because your steroid might be mild. And after the steroid is stopped also, you should continue your creams for a longer period of time so that the skin is kept under control and it doesn't flare up again and again. At times we do suggest thicker moisturizers like petroleum jelly. You can apply the petroleum jelly, but if you are using a steroid, especially in a child, you have to be aware that the steroid once applied, and then on top of that, if you're going to use the petroleum jelly, it is going to occlude the skin. In a sense, it will seal the skin and increase the absorption of the steroid inside the skin. So through the skin rather, into your system. Especially in cases of children, the steroid absorption would be higher and it will go into the system faster. So in that case, you have to check with your doctor if you can use the petroleum jelly about this, because if this is the desired result you wish to have, then yes, you can use the petroleum jelly. Apart from that, generally what you can think about is when you're using a moisturizer, you should try and select moisturizers with oats or with ceramides in them, and it ideally fragrance free. That would be more helpful. I hope this was of some help to you all. In case if you all want to ask any doubts or if you have any questions, please put them in the comments box. I'll be happy to answer them. Thank you and bye for now.